Welcome to Leadership and Culture in Healthcare. My name is Matthew Wynn, and this session is a culmination of 11 conversations I have had with very kind chief executives over the last few months. And I am delighted that I am joined by Michael West, who is going to introduce himself, but frankly doesn't need much introduction to hopefully people that listen to just have a think around and a discussion about the themes that we have been discussing on the podcast. Michael, welcome. Do you want to introduce yourself? And for those that don't know you, shame on them, but let's just explain who you are and what you get up to.
Well, thank you, Matthew, and thanks for inviting me. My name is Michael West. I'm Senior Visiting Fellow at the King's Fund and Professor of Organisational Psychology at Lancaster University. I've been involved in doing research in the health service since the mid-1980s when we first started studying healthcare teams. And during that time, the work I've been involved with has spanned the staff survey, looking at people management and outcomes in NHS organisations, looking at quality of care across the NHS in England, and latterly, particularly how we can create cultures that deliver high quality, compassionate and continually improving care across all our health and social care services. And it's been an absolute privilege for me.
Well, it's a privilege for all, especially to read the insights that you have published in droves on that topic. And should we start this conversation about the staff survey, because you've put so much effort and time into making sure that is a good survey and it's useful and it's evidence-based. And this podcast series started from, I guess my frustration that we don't use a staff survey effectively to really drive any change and support our organizations to improve. So let's maybe start with your reflections on the power of the staff survey that we do in the National Health Service, and also what's its potential beyond what we do at the moment.
So I think, it's really hard to overestimate how important the staff survey is. I think people don't realize this is the biggest, longest running annual staff survey anywhere in the world in any sector. It's just an astonishing data set that's been created over 20 years. And, way back in 2003, we designed it really carefully in close consultation with all sorts of stakeholders and with lots of reference to the best academic research methods. And over 20 years, we've been able to do the most sophisticated statistical analysis because we've got 20 years worth of data from now over 600,000 people a year. It's just a treasure trove of data. It's an important data set for telling us about what will make a difference to the performance of our health service. And just to summarize some of the key themes that emerge, firstly, the most important predictor of trust performance, as most people will not be surprised to discover, is staff engagement. But what's important to understand is that the element of staff engagement that is most powerful in terms of trust performance is the involvement of staff in decision making. And that's significant because most of the cultures in our health service are hierarchical, target-driven cultures, and quite the opposite of encouraging involvement in decision making. We also know that, and let me be clear, staff engagement predicts care quality, patient satisfaction, staff retention, financial performance, avoidable patient mortality, all of the things we care about. And but we also know from the staff survey what are the most important factors that influence levels of staff engagement. And supportive, compassionate leadership is the most important factor. Having leaders who are supportive, who listen, who are present with staff, who understand their challenges, who empathize with them and seek to help them in their work. But also what's important is an appreciative environment, staff working in cultures where there are expressions of gratitude, appreciation, celebrations of accomplishment. Relationships with colleagues are important, and particularly the quality of team working. So better team working is a really important factor for staff engagement. Cultures of inclusion and equity turn out to be vital. If you want to know what predicts patient satisfaction, the number one factor, it turns out, is workload. So the higher staff report their workloads to be, the lower is patient satisfaction. But the second factor is cultures of equity and inclusion. And the more staff are treated, in inclusive, respectful ways that value everybody's contribution, the better is care quality for patients, because patients are treated in those cultures with greater civility and compassion. And that, of course, plays out in financial performance as well. And then we see that burnout and workload are obviously really key negative predictors. So the more burned out staff are, the less we're able to retain them, the more absenteeism there is, the worse is care quality. And workload, of course, is the key factor. Chronic excessive workload is the key factor in burnout. It's the number one factor in staff stress and the number one reason outside of retirement why staff quit. And finally, and by no means least, the quality of team working, the extent to which staff are working in teams, turns out to be an absolutely critical predictor of trust performance. So the more that staff work in real teams, and I can explain what that means, the more staff work in real teams, the better is care quality, fewer errors, lower infection rates, better financial performance, much lower levels of avoidable patient mortality. When staff work in real teams, stress is 50% lower. And all that real teams means is we work in teams that have clear shared goals and meet regularly to review performance. The data from the staff survey tell us that probably only around 40% of staff work in such teams. So it's a huge area for potential improvement. So in summary, the staff survey is the best source of intelligence we have about the future performance of our organizations. And it tells us where are the areas we need to focus. I've just described them. It tells us where are the areas we need to focus if we're to achieve the outcomes that we seek. And currently, it's really frustrating that so many organizations see the staff survey as a bit like the pattern on the wallpaper that comes along with a slight change every year. Probably the wrong metaphor, but you know what I mean.
Yeah. I'm struck in what you've said, Michael, about you've used the word predictor many times in that descriptor. And it's interesting, I think, that we rarely talk about the staff survey as helping us understand in a predictive sense what may be going on in an organization. We talk about it as a barometer or a test of the past, as a retrospective view. What was the culture like, rather than what it is. But you're absolutely advocating that it's a complete, the results show, whether at ward, divisional, team level, it's a predictor of what's going on in that respect.
Yeah, so another way of thinking of it is if I want to know how North Bristol Trust is going to be performing in 2 years' time, probably the best measure that I can look at is its measures of staff engagement and team working and inclusion and burnout today. And if I want to ensure that the trust is performing well in 2 years' time, 3 years' time, then those are the areas I have to focus on improving. And again, one of my frustrations about the staff survey is there's this tendency to say, well, we're above average on these scores and these scores. And I remember Derek Feely, from the director of the Institute of Healthcare Improvement, at a discussion about this, saying it's not much of an aspiration to want to be the cream of the crap. So many of the measures in the staff survey indicate very, very poor staff experience. I mean, levels of burnout where over 1/3 of staff are reporting being burned out at work often or all of the time, with the dreadful health consequences we know for staff and the dangers to patient care we know for staff. We should be at least determined to ensure that our scores on the staff survey are as good as the best in the group of trusts with which we're compared.
Yeah, I'd agree with you. And it's one of the reasons why I've done this series with chief execs talking about their experience, because they are in the 22-23 data, which is what I use, the best in class in what they get up to. And we'll come on to them in a second. Just on the element of how you've linked finance, you've linked productivity, you've linked staff measures, and most importantly, you've linked outcomes for patients, people who use the services of the NHS. If I then think, what I see come to organisations within NHS from the national architecture, whether that be government, NHS England, other regulatory organisations, I rarely see focus on your engagement, focus on your team working, focus on these things, which you've just defined as saying they are pivotal to getting good outcomes. It's everything else but that. And I suppose my question from you, from the research and from your experience is, A, why that is, and B, what would it take to change that approach?
Yeah, I think part of it is a kind of, is a kind of collective desperation to get the outcomes that we want. And, it's like, I don't know, it's almost like I want my car to go as fast as it can on the motorway. So what I'll focus on is the speed of the car when I'm driving it, rather than the quality of the maintenance and how well I look after the engine. But if I keep demanding of the car, go faster, that somehow it will magically go faster, rather than doing the things that need to be done to ensure we're creating the conditions for outstanding performance. And it's as though there's this kind of collective assumption that if we focus on demanding the outcomes, achieving the targets, that will somehow magically happen. You can set me a target of, jumping at 8 foot in the high jump. I'm 73 years old. It's never going to happen. What's more important is perhaps to keep me fit and healthy, so that I perform as well as I possibly can in all sorts of domains. And in a way, that's the value of the staff survey. It tells us how we can create an organization that will function optimally. And take team working as an example, Matthew. I always think people think compassionate leadership is about being nice to people. It's not. It's about leaning into pain and difficulty. It's about managing the stuff that's getting in the way, like petty interdepartmental conflicts or bad behavior. And it's about ensuring our staff have clear direction, and that we're helping to remove the obstacles that get in the way of their performance, and helping to ensure they've got the resources they need. Very simply, I think one of the most important ways we can affect the outcomes is by making sure that team working is effective. And the most important factor in team working, 4 or 5 or 6 clear, challenging goals, because we know that's the most important predictor of team performance, whether it's an executive team or primary healthcare team or breast cancer team. And when you get teams to agree clear, challenging goals, team performance ensues. But those words are really important. 5 or 6 goals, not 56, because otherwise, you have so many priorities, you don't know what's important anymore. It's 5 or 6 goals, agreed rather than imposed, because we're more committed to goals we agree, and they're likely to be more intelligent because they're based on our local knowledge of what's going to make a difference. And challenging, because that's the whole point of goal setting, is to challenge us to do really well. But the critical element is that point about clear goals. And most of the teams we've studied, very often they'll say we've got clear goals, and then you get them to write down what their goals are, and they have, if there's 7 people in the team, 7 different sets of goals. They're not clear. But good team working is about having clear goals that we're working towards. And I know that in some of the conversations you have had, you've talked about simple architecture. And I think having clear goals at every level aligned around the vision of the organization is an absolutely critical part of that simple, clear architecture.
If I pull in some of the things then that chief execs talk to me about, which chimes very much with what you're describing, Michael. So I did an exercise to tick off kind of themes and say which one of the podcasts actually did it. And the ones that really stood out for me were clear accountability with a framework that you just described. And within that, if I was to do a kind of subset, is focus on a small number of priorities. And that was one of the biggest themes from those 11 chief execs. And the second big one was listening, engaging, and active talking with your staff and making sure that we're honest and authentic about what is happening to them and the organization at any point. So not talking about the great things all the time, talk about what's going wrong and what we can do about it. So that two-way communication and a framework. Those, if I was to boil all those conversations down to two whopping big points, those two would be what those chief execs talked about, which is what you're describing are two of the big ingredients for great care, aren't they?
I think it's so important to get those two things right. I always say to leaders, the most important skill of a leader is listening. And it's, it's fundamental to what I've talked about in relation to compassionate leadership and others. Compassionate leadership is built on being present with staff, truly being present with them, having the courage to be present with them, and listening with fascination. And that's about courage, because you'll hear things you don't want to hear. We don't have enough qualified midwives on the ward at the minute to deliver safe care for women and their families. What are you going to do about it? It's having the courage to be present and listen and have those authentic conversations in order that you can understand the challenges that staff are facing. And that's, I think leaders are often reluctant to do that listening and that authentic listening, because it's a scary time when we don't have enough staff and we can't retain them. But it's not the role of leaders necessarily to have solutions to problems. It is their role to bring attention to bear on the most difficult problems that we face. And you can't bring that attention to bear if you don't know what those problems are. And the only way you know what those problems are is by being present and listening with fascination to staff and understanding the problems and empathizing and showing that you care, that you want to help. And that's the most important task of leaders, is helping those they lead to have clear direction for their work and to do their jobs more effectively, through helping them remove the obstacles and ensure they've got the resources they need. And then in the work we did about 15 years ago now, a huge study for the Department of Health Policy Research Programme into the extent to which there are cultures of high quality care across the NHS, what emerged was exactly the point that you're making, is that there was really clear direction in the best performing trusts. They had a really clear vision and set of values, which was not just a bunch of words on the website, but was part of the DNA of the organization. People talked about that vision all of the time. It was, here's the touchstone, here's what we're here for, delivering high quality, compassionate care. But critically, it's also translated into those simple priorities at every level, from the board and executive team down to every department, every team in the organization. So those 5 or 6 clear, challenging priorities or goals, not what we saw in many trusts, which is what we came to call the priority thickets. There were so many priorities that no one could see what was important anymore, ironically. But the other element that emerged as important, Matthew, not to neglect, was that in these organizations, they had those priorities and they were collecting the data for every team and department in relation to those priorities, so that they were getting really intelligent feedback. And they weren't just being overwhelmed with a blizzard of data that didn't really help them improve how they were functioning. So those two, absolutely clear purpose and associated set of small number of priorities, and listening, engaging, and talking with staff in an honest, authentic way, creates the conditions, I think, for staff to engage in finding the solutions to the problems we face. Because that's what we saw in those organizations. Because staff were engaged and because there was clarity of purpose and there were good data, then people were much more involved in developing ideas for new and improved ways of doing things. It's teams that innovate. I always say, if you want to know what the best, if you want to know whether your team is functioning well, the best barometer is the team developing new and improved ways of doing things? Is it improving quality? Because that's what teams do. They bring together the diverse knowledge, opinions, skills, and experience of team members, and that inevitably, well, if it's a positive climate in the team and they've got clear goals, that inevitably leads to innovation and quality improvement.
Yeah. And I think that's a good segue into other things that the chief execs talked to me about. All of them, I think every single one, but they all described it in a slightly different way, talked about quality improvement methodology and systemically implementing an approach that that supported staff, supported teams to make that change. So and I think the role of leadership, how to make change, not just to tell people to change, but to tussle with them about how to make that change. And then I was struck by, and you've just mentioned this, how many of the chief execs talked about the importance role of data. Some patient feedback in real time. Bijou up at Northumbria talked about, they've really invested in real time feedback so staff can really understand what the impact of their work is. And then research. I thought Neil Carr at the Midlands Partnership Trust really aligning research and data to help people improve how things are happening. And though a methodology and data to help you understand how well you are doing must be crucial to underpin that change that you're talking about.
Yeah, and in a way, it's so fundamental, isn't it? I mean, the idea that I don't know, you think of a football team playing in the pitch black. We've got no idea how close we're getting to the goal. If we're not giving people the clear data to help them improve performance, then we're in real trouble. And clear data, it's not just about giving data, because as I said, you can overwhelm people with data. It's giving them the critical data and priorities. And I think that one of the things we've learned about quality improvement is it kind of doesn't matter which, Mary Dixon Wood's work in Cambridge has shown this. It doesn't kind of matter which approach to quality improvement you take. It's about having a quality improvement culture. And for me, that's like one of the 5 or 6 goals of every team in the organization should be developing new and improved ways of doing things. It's improving quality is one of the 5 or 6 goals. That's a key outcome for every team, so that it's built in. I mean, I did quite a bit of work in the manufacturing industry back in the 90s and the early 80s, and what we saw in the manufacturing organizations that were performing best was quality wasn't mandated from above. Quality was part of every team's work on the shop floor. And so it was that was how they did their jobs. It was always about attention to quality and improving quality. I've been really struck by something that Don Berwick once said in a meeting I was fortunate to have with him, where he said, if quality is not improving, then it's going backwards. And I think that's right. I mean, it's the nature of our universe. If things aren't in getting more structured, then they deteriorating into chaos in some way. And so building quality improvement into the responsibilities of every team is vital. But we also need then, I think, senior leaders to support innovation, to find ways of putting in place structures and processes which give teams the opportunity to implement ideas for new and improved ways of doing things, like companies like Kodak and IBM were doing in the aughties, having I think it was in Kodak, the Office of Innovation to support ideas for new ways of doing things. And I think the board and the executive team modeling innovation and talking about innovation. I mean, when we did that big study of culture, one of the things which I found very disturbing was that when we analyzed the board meeting minutes from 70 trusts over a 6-month period of their meetings, 80,000 pages of the most exhilarating material you can imagine, Matthew. Innovations introduced by the boards were about 1 or 2 in that 6-month period, only 1 or 2 innovations that they were supporting. And all of this, I think, begins with the board supporting the development of cultures of innovation rather than reinforcing target-driven hierarchical cultures.
And let's talk about that leadership then, because a big facet of my conversations with the 11 chief execs was about them as individuals leading, but also the ingredients of their organization that allowed leadership to flourish. I'm struck on two things of what you've just said. One is this is, again, going back to the systemic, purposeful approach of the organization started by the board, that leadership is right. And then the kind of, I guess, the corollary to that is the impact that leaders need to make a difference. So I heard in the conversations with them about not, and you said this, not shying away from tough conversations. Visibility means you have to be out and about. One of the chief execs described absolutely each month that he goes and does a job in the hospital. He dons and becomes a healthcare assistant. He does X, Y, and Z to listen and understand. But and then another element was, how do we ensure values are embedded? You've talked about the DNA of the organization, and part of that is about behavior. And how do we have our leaders role model the behavior that they want the whole organization to get behind? And that's quite a tough thing to pull off, isn't it? Especially when, I think about some of these organizations are 10,000 people. There could be 4,000 people. There could be 10,000 people. To role model and have that leadership impact is a tough thing to do, isn't it? Especially in an organization that might not have that culture at the moment.
Yeah, it is a tough thing to do. One of the reasons why the concept of compassionate leadership has been welcomed, I think there are two reasons. One is because compassion is at the core of our health services. It's, what we've seen across the NHS is there's a universal commitment to the delivery of high quality compassionate care. It's a core value of staff. There's 0.1% who aren't like that, but it's a universal commitment basically. So I think it's been welcomed for that. I think secondly, it's been welcomed because it's a relatively simple concept. There are 4 behaviors of compassionate leadership. It's first of all being present and listening with fascination to those we lead, having the courage to be present, as I said. And I just want to distinguish between, I suppose I would say, visibility is one thing, presence is something else. I can be there on the shop floor, I can walk around. It's being present with people. I mean, it's kind of being, it's not being, in one sense, it's not being there with an agenda. I'm having a conversation with you, and that's where my presence is. I'm not thinking about what I'm going to get out of this or what's going to happen next. It's just being present with you, 2 human beings, and I'm listening with fascination. And so when chief execs and board members, and they're all responsible for this, are present, that presence has a kind of ripple effect. People don't just have an interaction with somebody influential and senior and walk away from it without being affected by it. And when leaders are present and empathic and want to help, it has a hugely positive impact on those around them. And I was looking at some data from some new research showing that there's kind of 3 degrees of replication of these behaviors. So when my leader treats me compassionately, I go on to treat those around me compassionately. They go on to treat other people around them compassionately. And suddenly you're getting ripple effects in the hundreds of thousands. So the leader doesn't have to be there with every single one of the 10,000 people. But what they do have to try and do is do this in an authentic way, being compassionate. And I mean, the other thing I say to leaders, that I would say to chief execs and executives and board members, is, look, probably the only thing of importance you have any significant influence over is the culture of the organization. You don't control this organization. What you can influence, and it's the most important thing you can influence, is the culture. And that's about the values of the organization, and that's about you modeling the values. So it's not just about talking about compassion and authenticity and honesty and respect. It's being that human being in the way that we behave. And I believe, I mean, the staff survey is really helpful. It's got great measures of compassionate culture and leadership in it as a kind of indicator of how well we're doing. I think every leader every year should be getting feedback from their staff about how well they're modeling those behaviors of attending, understanding, empathizing, and helping. And we can also do, as the NHS in Wales is doing, is building all this into our recruitment processes, our training processes, our workforce plans, our policies, our procedures, and providing national training so that we create a national culture in our healthcare system that reflects the core value of our staff, which is that determination to deliver high quality, continually improving and compassionate care.
Yeah. And it's a great ambition, isn't it? Because we talk about the National Health Service, but wouldn't it be great that the National Health Service wasn't just known by its outcomes and universal elements, but actually the culture of the type of care that it delivered and the types of leaders it employs. When I think about the leadership elements that from those chief execs, I think really came through clearly was the authentic bring your whole self to work. That really came through so often, that this was almost a mission. This was part of their public service. It was interesting. Quite a few of them used the word public service, and I feel it's a dirty word nowadays. But actually, they were servants. They were servants of their organisations. They were servant leaders in that respect, and they had all made themselves accessible, and their staff had hear from them directly. They don't just send out crafted communication messages. They send out stuff that they have written, they had tussled with, and people heard directly from them, especially at induction. They heard directly from their leaders, not from a set patter. And that's all what you're talking about, isn't it? That's all really practical but important DNA of creating great culture.
Absolutely. It's the genetics of great culture. And I always reflect, Matthew, we've got the biggest, most motivated and most skilled workforce in the whole of industry. Why do we try to manage the national system in a kind of command and control, directive, target-driven way? It's just absurd. It makes no sense. That actually what you see, as you describe in the best leaders, is this authenticity. It's a way of being. They're bringing their being into the workplace and modeling that compassion and authenticity and the humility to say, yeah, I don't know what to do here. What do you all think? That's what great leaders do. They draw on the resources, the knowledge and skills and abilities of the people they have the privilege of leading. And that, I think, authentic, compassionate, humble way of leading is what builds trust among staff, and trust is, as it's kind of gold. And the NHS as a national system, I agree with you. I mean, I've come to think it's the most influential agency in our society. It's the biggest employer. If all of the 1.4 million people who work in the NHS come into work every day and encounter compassionate leadership, inclusive cultures where everybody's valued and respected and supported, and compassionate cultures, they inevitably take that back out into their families and communities. And it also has this huge impact on the quality of care that is provided. And after all, everybody has touch points with the NHS frequently throughout our lives. And if what we experience is that compassionate, inclusive care, again, we take that out to our families and communities. And I think it's particularly important at the moment in a time when we're seeing increasing or decreasing psychological well-being, more mental health problems amongst young people, more disconnection. I was shocked last week to read that 30% more people living in Europe over the course of the last 10 years now live alone. We're seeing this increasing loneliness and disconnection. Well, the NHS, I think, is the most important institution in our society for moving, if you like, against that trend to create more compassionate, connected societies where the idea of public service and community engagement and looking out for our neighbours and looking out for for each other is at the core of our society. And so the NHS, I think, plays an absolutely vital role in the future health and well-being of our nation.
Yeah, I agree with you. And I think last couple of things just to reflect on, Michael, because you've been most kind with your time and insight. When I reflect on the 11 conversations I've had, and this won't be a surprise to you, given you've already said this in this podcast, these organizations and leaders on the whole have been tussling at this change for quite some time. So there are some leaders in there who have been there for 10, 12, 15 years leading their organizations. But interestingly, where they're newish leaders, and there were a few chief execs that were into the first year or second year of their jobs, they have inherited a culture that has been grafted and changed and adapted and molded, but they had often been part of that approach as executives, and they have been birthed and almost I don't know, whatever analogy I could do, I don't want to use sheep dip because that's one off. It's immersed in that culture, and therefore it's not unsurprising that they're continuing that culture and ensuring that happens, and there's continuity. And I guess that's the one thing about creating a DNA. That's the one thing about creating longevity, isn't it? Is that you have that continuity coming through rather than short-term heroic leadership that thinks it can make a difference. And you must have seen that so much in your analysis and your writing as well.
Yeah, and in my own leadership career, I had the privilege of being dean of a business school in Birmingham for a number of years, and I took on that role from a really inspiring leader who embodied a lot of the ideas we've been talking about today. And it was a huge privilege for me, both to persist with pursuing the directions that he had helped shape. And then building on them as well. I think one of the most underrated notions in leadership is the notion of persistence. There's this kind of idea that we've got to get the next new big shiny thing. Well, most of what we talked about this morning, we've known in relation to leadership are critical. We've known this for the last 60 or 70 years. It's about listening with staff, being present with them, understanding their challenges, empathizing with them, caring for them, and then helping them and ensuring they've got clear direction. We've seen all this stuff. We know that it's providing good data. You referred to Northumbria, and they're feeding back real-time data on patient experience. It just makes so much sense. We learn when we get good feedback quickly, and then we can innovate and adapt because we've got the data that is at the basis of good research and good quality improvement. So I think it's let's avoid the tendency to reach for the next new big shiny thing and go with what we know works and persist with it, not for 1 year or 2 years, but for 15, 20 years. I'm working with the NHS across Wales, as I said, and they have a 10-year strategy to develop compassionate leadership and inclusive cultures across the whole of health and social care. And they've been pursuing that for 4 years now. And no sign of letting up. And the 11 trusts chief execs that you've had conversations with are fantastic, inspiring examples that give hope. Let's go and learn from them. I mean, the podcasts that you're developing are a great opportunity for leaders across the system to learn from, because I find what's most helpful for people when I go out talking to audiences within the NHS is these inspiring examples of where people are getting things right. That's what gives hope in the dark.
Yeah. Michael, you've somehow again managed to summarize so much of rich complexity into just barnstormingly sensible elements. I love your point about fascination, be present, use data well, and also a real call to arms about using the data and research, because it is a predictor of quality, it's a predictor of performance, it's a predictor of finance, it's a predictor of outcomes, and use it in the most purposeful way. I've had the privilege to listen to 11 chief execs describe how they do that, and you have described how your research kind of backs all that up. For those that are listening, we will put a summary on the podcast so people can read more. Final reflection from you maybe about what your hope for leaders kind of going through the next couple of years, when we're facing a general election, we're facing all of that oscillation. Times feel really tough at the moment as well, and you described as the NHS being pivotal in society, being able to be a positive impact. What does that mean for our leaders need to do day by day and all the time over the next period?
Yeah, I mean, I've really enjoyed the conversation, Matthew. So thank you. It's been a privilege for me. And I think one of the underlying themes is that leadership is not a kind of cloak you put on when you come to work simply. It's a way of being as a human being. It's about authenticity. It's about continually learning to be present with those we lead, having the humility to learn from each other, from different organizations. It's about the nurturing our capacity to empathize, even though it's really difficult at times. It's hard to empathize with the nurse on her third 13-hour night shift in a row when she hasn't had time to take her rest break and she's exhausted and frustrated. But that's what compassion is. And sometimes it feels really hard when you want to help and you don't know what to do. So it's about having the humility as a leader to recognize that compassion is tough, and that it is about leaning into the difficult at times, but to recognize also that being compassionate as a leader in the health service is the only way forward, and that being compassionate is actually benefits us as human beings. So all of the data we have tells us that as leaders, when we're compassionate, not only does it benefit the other, but it helps us as well. We feel better, we feel happier, we feel healthier. And to recognize then that leadership is a privilege, and that being a compassionate leader is a way of being, and recognizing, I would say, that being compassionate, as Paul Gilbert says, is a sensitivity to suffering in self and others with a commitment to prevent or alleviate it. So it's also about having the courage to be self-compassionate, because the more we can practice self-compassion as leaders, we know that that then transmits out into how those we lead behave towards those they provide care for. So these are big lessons, not just about leadership, but about ways of being as human beings.
Michael, thank you so much. On the podcast, additional information, there's some top tips from chief execs, which we haven't had time to talk about today, but I will make sure they're on there about how they look after themselves. And that goes to the heart of what you were saying, which is this is a marathon, and you need to do things to keep that enthusiasm, to keep that inquisitivity. That's even not a word, is it? Inquisitiveness. And
it's
also
it's a new word. It's lovely.
And the authenticity that we've been describing. Michael, thank you so much for sharing your insights and your thoughts, and frankly for all the fabulous work that you do to inspire everybody to be great leaders and compassionate cultures.
Thank you, Matthew. It's been a delight to talk with you.